The Delta Region Community Health Systems Development Program is a collaboration of the Health Resources and Services Administration's Federal Office of Rural Health Policy and the Delta Regional Authority. Through a cooperative agreement with the federal office, the National Rural Health Resource Center administers the program and manages the provision of services to the selected healthcare organizations and communities. The National Rural Health Resource Center will provide technical assistance to 10 new healthcare organizations annually. Eligible applicants include small rural hospitals, clinics, and other healthcare organizations located in the Delta Regional Authority designated counties and parishes.
This program has changed our organization. When we started, we had literally just filed for Chapter 9 bankruptcy. We needed a strong partner with a lot of resource, and DRCHSD program brought that to bear. We were able to get the right technical assistance at the right time to help turn things around. And by engaging fully with the program, we have moved through the bankruptcy process. We are now in a 5-year plan period, and we are meeting those goals, even during COVID, which is huge. Having been part of this program, having established the relationships and taken advantage of the technical assistance that is there, has really changed my perspective on how valuable this program truly is and what it really brings to bear.
The purpose of the program is to assist leaders and providers in identifying and addressing healthcare needs while strengthening the local healthcare system. Selected healthcare organizations and their communities receive technical assistance to make in-depth health system enhancements over multiple years with the goal to improve financial position and increase operational efficiencies, implement quality improvements that support an evidence-based culture for improved health outcomes, address workforce recruitment and retention needs, increase use of telemedicine to fill service gaps and access to care, ensure access to and ability of emergency medical services, integrate social services to address socio-economic challenges, enhance coordination of care and develop a community care coordination plan, strengthen the local healthcare delivery system to position for population health.
When we can have the ability to connect peer-to-peer and talk about different solutions for different scenarios, whether we're talking about telemedicine or whether we're talking about rolling out a program that is going to deal with the opioid crisis, take your pick, any sort of a challenge that might be surfacing for your community. I guarantee there's somebody else out there that is not only experiencing that, but that is trying to find ways to manage it, and they may have found ways to deal with it that could be a best practice. In being able to meet with those people and talk through what you have tried or what they have tried has really proven to be incredibly beneficial.
Selected participants receive various consultations for financial, operational, and quality improvement, as well as telehealth and revenue cycle and physician practice management. We also provide an annual employee engagement assessment and then provide leadership and workforce development opportunities. The program also provides funding to support telehealth and financial system enhancement funding, which provides hardware, software, and training to expand telehealth services.
If you're willing to put in the time and the energy and to support the program from the top down, where you really truly engage, not just take it for granted that this program is going to sort of auto-magically come in and solve all of your challenges in and of itself, but that you and your team are going to have to be the boots on the ground to do the work and provide the feedback to make it work for your particular facility.
Community care coordination involves establishing diverse partnerships between health and social service providers to address those needs that extend beyond one's clinical care and take into consideration the social determinants of health. This includes access to food, transportation assistance, or even housing, just to mention a few. All of which, if left unaddressed, could disproportionately affect the health outcomes of an individual or population. Through a stepwise approach, the Delta program collaborates with the selected organizations to establish a foundation for community care coordination. One of the most important steps in this process involves working with the organizations to identify and hire a community liaison, also referred to as a community champion through the Delta program. This community champion's role is vital in that they help to orchestrate and coordinate the partnerships and collaborate activities through the program period. Over the course of 3 years, we partner one-on-one with those organizations and their selected joint partners to assess the community's health status, prioritize focus areas, develop action plans, and implement activities to improve the health outcomes for an individual or population. Through our experience, this process helps to build and strengthen a community's capacity. It creates accountability and buy-in. It also helps to create a map towards sustainability to continue those efforts.
I'm so grateful for the opportunity, all of the trainings in which has been afforded me for these past 3 years, being a community champion within this area. Well, when we began in 2017, there were very few that joined this collaboration. But as of today, there's over 30 businesses within this area that has joined us, and we have seen astounding results. We're so grateful for all of the training that the National Rural Health has assisted us with this past 3 years, and the training that the Delta Region, through the Delta Region Project, that we have been given. The people at Delta Region are our friends. They are so versed in helping to aid you in developing a community that will be prosperous in the future, that will be able to increase our collaborations. Never once have they ever come to us with a know-it-all attitude. We're located deep in the south of this county with very limited resources, but when they come to us in our training, they sit down with us, they eat with us, they talk with us, they fellowship with us, and therefore they have truly become one of us, and our community loves them dearly and accepts their advice wholeheartedly. We have developed a plan of continuation past this point when this cohort ends. Even work during the pandemic, teaching us new strategies, giving us new ways and techniques to be able to still stay in touch with those that are within our collaboration. And this has truly proven to be very successful.
To date, the program has provided over $1.6 million in reimbursement for hospitals. For our Cohort 17 facilities, net patient revenue has increased by a combined total of 14.4%, and all-cause readmission rate has improved from 12.4% to 9.5%.
You can make huge strides if you're willing to put in that work.
Eligible applicants include small rural hospitals, critical access hospitals, and prospective payment system acute care facilities up to approximately 100 beds, rural health clinics, and other healthcare organizations located in the Delta Regional Authority designated counties and parishes. Eligible organizations must be willing, able, and ready to undertake a large, comprehensive project over multiple years and fully participate in all phases and activities to meet the program purpose and goals. Eligible organizations are considered based on their congruence with program purpose and goals as well as leadership's commitment to fully participate in all phases of the program over multiple years. Applications are accepted on an open and rolling basis and may be submitted anytime during the year. Applications remain on file and eligible organizations are considered for future openings.